Hello, I am Dr.G.Sunil Kumar, Chief Consultant of SK Clinic and Scans, Poovar. Today, my topic is neck pain. Neck pain can be caused by a number of factors including muscle or ligament strains, arthritis, or a pinched nerve. Approximately 10% of adults have neck pain at any one time. Females seem to be affected more than males. Most of the time, regardless of the cause, pain improves with conservative therapy. This topic review discusses the causes, evaluation, available treatment methods, and most common types of neck pain. The neck or cervical spine is formed by seven square-shaped bones called cervical vertebrae, which are stacked one on top of another. The vertebrae are named for their position in the neck, beginning at the top with the C1, C2, C3 and down to C7. The skull and upper cervical vertebrae are uniquely connected to allow for movement of the skull. Together with the supporting ligaments and the overlying long neck muscles, the cervical vertebrae form a strong spinal canal that surrounds and protects the spinal cord. The leg bones are the discs which functions as shock absorbers, providing cushioning between the vertebrae. If there is excessive pressure on the disc, this can cause the inner jelly-like material to protrude to its outer capsule. This is called a herniated or slipped disc. Look into the causes of neck pain. There are many possible causes of neck pain, although it is often difficult to know with certainty what is causing pain. This is because the physical examination and even imaging tests are not able to easily differentiate among the various potential causes. In addition, degenerative bone and joint changes visible on imaging tests often do not correlate with the severity of pain. In other words, it's possible to have neck pain with relatively normal imaging tests or to have no pain despite significant abnormality on imaging. First, we will check each causes. First one is cervical strain. Cervical muscle strain can occur when there is an injury to the muscles of the neck, causing spasm, that is sudden tightening of the cervical and the upper back muscles. Cervical strain may result from the physical stress of everyday life, including poor posture, muscle tension, from psychological stress or poor sleeping habit. Sports-related injuries can also result in cervical strain. Typically, cervical strain symptoms include pain, symptoms and tightness in the upper back or shoulder, which may last up to 6 weeks. Next cause of cervical pain is cervical spondylosis. It's a condition caused by abnormal wear and tear called degenerative changes of the cervical spine. This leads to gradual narrowing of disc space, a loss of normal square-shaped bone, and bone spurs, that is growth at the edges of the bone. These spurs can increase pressure on the surrounding tissue and lead to pinched nerves. Some degree of wear and tear is expected with normal aging, although severe degenerative changes are not typical. Symptoms of cervical spondylosis can include neck pain or weakness, numbness or abnormal sensation of the arms or shoulders, headaches, or limited ability to move the neck. Ear pain has also been associated with the upper cervical spondylosis in some cases.
Cervical discogenic pain may be the most common cause of neck pain. It is caused by degenerative changes in the structure of one or more of the discs in between the cervical vertebrae. Common symptoms of discogenic pain include pain in the neck when turning or tilting the head. Pain may be worsened when the neck is held in one position for prolonged periods, such as when driving, reading, or working at a computer. There is often associated muscle tightness and spasms. Discogenic pain also causes referred pain or odd sensation into the arm or shoulder. Cervical osteoarthritis is the next cause of neck pain. The facet joints are located on sides of the vertebrae, and arthritis in this area can cause pain in the middle or side of the neck. Some people also notice pain in the shoulders, around the shoulder blades, at the base of the head, into the ear and jaw, or in one arm. A common cause of pain due to cervical facet arthritis includes a job or other activity that requires repeated extension of the neck, that is, tilting the head backwards. Whiplash is a term used to describe injury caused by a traumatic event that causes an abrupt forward or backward movement of the neck. The most common cause of whiplash is a motor vehicle accident. A similar type of injury can occur in sports when there is a significant blow to the body and the neck has to control the motion of the head. Whiplash can affect many of the structures in the neck, including the muscles, ligaments, and joints. Symptoms of whiplash can include severe pain, spasm, headaches, ear pain, jaw pain, and loss of range of motion of the neck. Cervical radiculopathy occurs when a nerve root is irritated by something pressing on it. Example, a protruding disc, arthritis of the spine, or a mass or a cyst. Symptoms of radiculopathy can include weakness or changes in sensation such as numbness or tingling in the arms. The most common cause of cervical radiculopathy include degenerative changes related to aging or injury, herniation of cervical discs. Cervical foraminal stenosis is another cause for neck pain. Foramens are openings in the vertebrae from where nerve root exits. Cervical foraminal stenosis occurs when joint degeneration causes the formation of bone spur. This results in narrowing of the opening, causing the nerve root to become compressed. Effect of this condition include pain, numbness in the shoulder, arm, or the hand that are supplied by the compressed nerve. Trauma of cervical spine can be ranged from mild injury to life-threatening following injury to the spinal cord. Impact of injury can cause vertebral fracture, vertebral dislocation, ligament damage, or spine compression damage. Injury to the nerve of the spinal cord can cause numbness, pain, and paralysis. Some vertebral fracture requires surgery to stabilize the spinal cord, muscle, and ligaments.
Nerve roots exist from the spinal cord through the opening of each cervical vertebrae. The intervertebral disc located between the vertebrae prevents friction and the smooth movement of the vertebrae. Spinal stenosis is the condition caused by the disc degeneration of the cervical spine. This causes formation of bone spurs, leading to narrowing of the spinal canal and vertebral foramen. The narrowing of the opening causes compression of the spinal cord and nerve root. Compression of the cervical nerve root causes motor and sensory deficits supplied by the affected nerve. Compression of the spinal cord can cause abnormal reflexes, disturbance of balance, muscle weakness, or incoordination. Neuropathy occurs when there are degenerative changes that narrow the central spinal canal. This narrowing can injure the cervical spinal cord or cause it to function improperly. In addition to pain and loss of motion, signs of cervical spondylitic myelopathy may include a variety of neurological complaints: weakness, difficulty walking or coordinating movement, inability to empty or control the bowel or bladder, and the sexual dysfunction may occur as a result of irritation of the spinal cord. If you have persistent neck pain, you should see your healthcare provider for evaluation. They can try to determine the cause of your pain and recommend treatment. You should also see your provider right away if you have severe pain, experienced a serious head or neck injury, lost the ability to control your bowel or bladder, or have numbness or changes in sensation in your arms or legs. Your provider will observe your ability to move your head to left and right, forward and backward, and side to side. They will also observe your posture and the movement of the neck and shoulders and feel the muscles in your neck, head, upper back, and shoulders to detect areas of pain or tension. They may conduct strength, sensation, and reflex testing as well. Most people with neck pain will not need an imaging test. However, in some cases, an imaging test such as X-ray, CT scan, MRI scan will be recommended. Whether you need tests and which tests are recommended depends on your age, symptoms, medical history, and examination. In most cases, neck pain can be treated conservatively with the over-the-counter pain medication, ice, heat, massage, and strengthening and or stretching exercise at home. If you still have pain or restriction in movement, restrictions after a week of conservative treatment, see your healthcare provider for further evaluation. Provider may prescribe pain relieving medicines such as non-steroidal anti-inflammatory drugs. For some people, ice applied to the sore area can help relieve neck pain. In general, for acute injuries, ice is recommended as the initial treatment, especially if swelling is present. You can also relieve muscle tightness by placing a bag of frozen vegetables, or frozen towel to the painful area. The cold source should be wrapped in the thin dry cloth layer before it is placed on the neck to protect the skin. The ice or cold pack should be left in place for 15 to 20 minutes to deeply penetrate the tissue. This can be repeated every 2 to 4 hours until symptoms improve. Skin damage can result from excessive use of ice, especially in people with a poor skin sensation. It is a good idea to inspect your skin each time you apply ice. Look for changes in pigmentation. For example, lighter or dark colored areas, and let your healthcare provider know if you notice any problem. Another method is heat. Heat can also help to reduce neck pain in some people. Apply moist heat for 10 to 15 minutes with a shower, hot bath, or moist towel warmed in microwave. A heat towel. Be careful not to overheat as this can cause skin injury. Another method is stretching exercise. You can help restore and preserve your range of motion with the exercises that stretch and strengthen the neck muscles. Range of motion exercises and stretching may help decrease pain and from muscle injury. It is best to perform stretching exercise when the muscles are warm, such as after the application of heat or after a few minutes of cardiovascular warm-up exercise. Exercises can be done in the morning to relieve stiffness and again at night before going to bed. Expect mild, achy muscle pain if you pain in your shoulder or arm. Tell your healthcare provider. If you have had a serious neck injury, do not try any new exercises or structured exercises before talking to your healthcare provider. Also, do not attempt these exercises if you have a pinched nerve in your neck, especially if there is pain or numbness into the arm and hand, unless recommended by the healthcare provider. While these exercises can dramatically improve symptoms of pinched nerve, they can actually make the problem worse if you done improperly. Strengthening exercises. It is good idea to warm your neck and upper back muscles by taking a warm bath or shower or applying a heating pad or moist warm towel. Exercises are most effective if you do them twice a day in the morning and before bed. The exercises include neck rotation. Slowly look to the right, hold for a few seconds, look straight ahead and rest for a few seconds. Repeat 10 to 15 times. Then perform on the left side. Next is neck tilting. Look straight forward, then tilt the top of your head to the right, trying to touch your right ear to your right shoulder without raising your shoulder. Hold for a few seconds. Then return your head to center. Repeat 10 to 15 times. Then perform on the left side. Next exercise is neck bending. Tilt your head forward and try to touch your chin to your neck using a nodding motion. Hold for a few seconds. Breathe in gradually and exhale slowly with each exercise. The movement helps relax the muscles. Repeat 10 to 15 times. Relax your neck and back muscles in each neck bend. Then next, shoulder rolls. In a sitting or standing position, hold your arms at your sides with the elbow bent. Try to squeeze your shoulder blades together. Roll your shoulders backward 10 to 15 times, moving in a rhythmic rowing motion. Proper neck alignment posture is important during this exercise. Rest, then roll your shoulders forward 10 to 15 times. Next, scapular retraction. While seated, hold your head in a neutral position and draw your shoulder blades backwards towards each other. Hold for 10 seconds, then relax. Repeat 10 to 15 times. Deep neck flexors strengthen. Lie on your back on a flat surface, then draw your chin down towards your chest and inwards while contracting the deep muscles of your neck. For initial exercise, keep your head in a contact with the ground and just tuck. Hold for 5 seconds, then relax. Repeat 10 to 15 times. Next exercise is chest wall stretches. Stand in a doorway and hold your arm out to your sides with your elbows bent and your palms facing out. Place your elbow against the door frame, slightly below shoulder level. Then lean your chest forward while keeping your head in a neutral position and as you slowly stretch your shoulder and chest muscles. Hold this stretch for 20 to 30 seconds and repeat 10 to 15 times. These are the exercises. Now, next is stress reduction. Emotional stress can increase neck tension and interfere with a with or delay the recovery process. Reducing stress may help to prevent neck pain from recurring. Relaxation technique can relieve musculoskeletal tension. An example of relaxation exercise is to take a deep breath in, hold it for a few seconds, and then exhale completely. Breathe normally for a few seconds and then repeat. Other activities that may help to reduce stress include meditation, mindfulness-based stress reduction programs, cognitive behavioral therapy, or progressive muscle relaxation. Posture also is important in causing neck pain. You can prevent or reduce neck pain by doing activities and using positions and emphasize a neutral neck position and minimize the tension across the supporting muscles and ligaments. Extremes of range of motion and position that cause constant tension should be minimized or avoided. Avoid sitting in the same position for a prolonged period of time. If you work at a desk, try to take a periodic 5-minute breaks throughout the day. Avoid looking up or down at a computer monitor. Adjust it to your eye level. Visual changes or new glasses prescription can also affect the way you hold your head and the neck to read. If you like this video, please like, share and subscribe. Thank you.